Welcome to Prepared Tennessee LTC, a podcast created to provide resources and information on the current topics experienced within Tennessee long-term care and skilled nursing communities. I'm your host, Rachel Turner, an Associate Program Manager here at Vanderbilt University Medical Center's Program in Disaster Research and Training. Today, I am here with Dr. Michael Freeman and Dr. John Walsh, two co-directors of Vanderbilt University Medical Center's Program in Disaster Research and Training. Please join me in listening to their presentation on the CMS Final Rule.
Good day, my name is Michael Freeman, and I'm with Dr. John Walsh, and this is Introduction to CMS Final Rule. The Medicare and Medicaid programs' emergency preparedness requirements for Medicare and Medicaid participating providers and suppliers, which is Final Rule 81 FR 63860, implemented on September 16, 2016, known as the Final Rule, establishes national emergency preparedness requirements for participating providers and certified suppliers to plan adequately for both natural and man-made disasters, and to coordinate with federal, state, tribal, regional, and local emergency preparedness systems. Because the individual regulations for each specific provider and supplier share a majority of standard provisions, CMS developed Appendix Z to provide consistent interpretive guidance and survey procedures located in a single document. CMS Final Rule requirements in the Basic Emergency Preparedness Program consists of an emergency plan, an all-hazards approach, facilities-based approaches, risk assessment approaches, and training and testing programs.
Utilizing the recommendations listed in this document will assist in the basic understanding of the components of the Final Rule. This will help you develop the skills and the knowledge to assist in establishing your facility's emergency preparedness program. It'll provide guidance in developing the core components of your facility's emergency plans, and it's going to aid in achieving the capacities and capabilities for meeting and exceeding the Final Rule requirements.
The requirements are a comprehensive composite of three elements focused on maintaining healthcare services during emergencies, and they include safeguarding human resources, maintaining business continuity, and protecting the facility's physical resources.
The Final Rule requires that each facility develop an emergency preparedness program for meeting the health, safety, and the security needs of its patients, residents, staff, and visitors. Of the 17 provider and supplier categories, most requirements are similar, but there are distinct differences, and you need to be aware of what those differences are.
Appendix Z of the State Operations Manual offers interpretive guidance and is a foundational resource for facility emergency preparedness. Appendix Z provides survey procedures, which give the facility information regarding what surveyors will most likely look for and what questions may be asked during the facility survey process. Appendix Z is composed of 44 emergency preparedness standards. However, not every provider and supplier type are required to address each of these 44 standards. Only those standards designated for Section 483.73 apply to long-term care and skilled nursing facilities.
Fundamentals of an emergency preparedness program, and this is something that you need to learn because you're going to get surveyed on these particular aspects of your emergency preparedness program. Each long-term care and skilled nursing facility must develop a comprehensive emergency preparedness program which consists of 4 core goals. You have to develop an emergency plan from a community-based risk assessment utilizing an all-hazards approach. To implement an emergency policies and procedures to meet those hazards, and you have to implement an emergency communication plan as well. Also within the requirements are to execute a training and testing program.
The emergency plan is the framework for the facility's operational map when dealing with an emergency event or disaster. Plans vary among individual facilities and include areas of focus such as operational plans and policies, preparedness plans, continuity of operations plans, recovery and mitigation plans, and other types of plans directed at specific actions associated with a facility's needs and resources. The emergency plan does not require a specific template to follow, but it must meet the standards outlined in Section 483.73 of Appendix Z.
One aspect of your emergency plan must be an all-hazard approach. And what this means is an integrated process which includes identifying multiple hazards that may impact your facility. They include natural hazards such as tornadoes, floods, winter storms, wildfires. If you live in the western or eastern part of Tennessee, that will include earthquakes. You also have to look at man-made hazards such as terrorist events, chemical or hazmat events, or health threats. And you also have to look for technical hazards such as cyber attacks, power failures, and dam failures if you have dams within your locale. On February 1st, 2019, referenced in Section �QS019-06, all CMS added an emergency infection diseases to be included as part of the all hazards approach. These approaches require developing emergency preparedness capabilities and capacities based on your facility's needs and resources, and this is to meet the wide range of foreseeable hazards. Not all facilities need to address the same hazard, but all facilities must develop preparedness and response plans pertinent to their local hazard threats assessment.
Facilities must develop their emergency preparedness plans based on their facility's needs, resources, and their capabilities and capacities. Factors that play important roles in each facility's plan include resident and community population, geographic location impacted by local hazards, facility type, access to local and regional resources and assets, organizational and administrative support. Corporate and community system-wide emergency preparedness plans can cover multiple locations. However, if a particular facility has a specific hazard or a preparedness issue unique to that facility, their plan must incorporate actions or operational elements that address that particular threat or need.
The process of assessing risk requires facilities to assess potential hazards and threats to their operations, their residents, their staff, and their visitors. This comprehensive process can include several assessment methods for determining threat impacts. Probably the most common you will run into is designed by Kaiser Permanente called the Hazard Vulnerability Assessment or Hazard Vulnerability Analysis, or commonly called the HVA. The next is the Threat and Hazard Identification and Risk Assessment, and another common assessment is called the Stakeholder Preparedness Review, or formerly called the State Preparedness Report. Each approach allows communities and facilities to evaluate their own localized preparedness levels and requires the collection of certain data to be used for determining hazards, capabilities, and identifying capability gaps. The information and data derived from this process can then be used to develop the facility's emergency preparedness and response plan for dealing with emergencies and disasters. County emergency managers, local responders, and your regional healthcare coalition can assist in developing your assessment. Many local agencies have been conducting these assessments for years and will be willing to assist you in this process. There's no requirement that you have to use a specific HVA template, but many of the healthcare industries use the HVA tool developed by Kaiser Permanente called the Hazard and Vulnerability Assessment Tool. The HVA tools can be used for assessing risk for natural, human, and technological hazards, and it establishes disruption probabilities based on severity of the impacts to the property, human, and business factors. The tools are used to consider issues related to preparedness, such as status of current plans, and also considers both availability of internal and external resources. Each long-term care and skilled nursing facility is required to establish and conduct a training and testing program based on its facility emergency preparedness plan. This includes conducting a facility risk assessment, developing a set of specific policies and procedures for dealing with your facility threats, and developing a communication plan which is also designed for your specific facility. During a specific 12-month period, facilities must participate in one full-scale exercise and conduct one tabletop exercise. Facilities can contact their regional health coalition, their county emergency management agency, one of their other emergency response agencies such as their local police or fire department to obtain a schedule of exercises to be conducted locally or regionally in your area. There are the two types of exercises that you have to prepare for your full-scale exercise, and these are considered operationally focused and typically require the collaboration and participation of multiple agencies, jurisdictions, organizations consisting of responders, service providers, stakeholders, and anyone performing response activities as they would during an emergency or disaster event. Again, these full-scale exercises are usually conducted with your healthcare coalitions at least once a year, and you're encouraged to participate in these particular exercises to fulfill your obligation. One thing that you can do on your own as a facility is conduct tabletop exercises. And these are simulated scenarios conducted in a discussion format, usually among various staff, key decision-making personnel, senior staff, elected or appointed officials. These are a lot of times very, very beneficial to conduct. They're easy to put together once you get the understanding of what a tabletop exercise is. The makeup of personnel can vary widely depending on the targeted scenarios. And tabletops are used in a variety of ways, evaluating policies and procedures, testing protocols, and clarifying roles and responsibility during an actual emergency. If a facility is involved in or experiences a real-world event, it can be exempt from participating in a full-scale exercise for a 12-month period following the actual event and documentation of the event with after-action reports.
Not all sections of Appendix Z will apply to all 483.73 long-term care and skilled nursing facilities, so it is important for those designated as responsible for emergency preparedness to be familiar with all the provisions contained in Appendix Z. Facilities will need to pay close attention to each provision and make sure your plan incorporates a comprehensive approach addressing each of the requirements. Pay close attention to the survey procedures found at the end of each section, for each of these procedures will give you an indication of what surveyors will ask and look for in assessing whether your plan meets the Appendix Z requirements. Remember, your plan must integrate with other response components within your local and regional communities, such as public health departments, emergency management agencies, emergency medical services, healthcare coalitions, and law enforcement agencies and fire departments.
If you have questions regarding anything that was mentioned in today's podcast or would like to learn more, please visit our website at www.emergencyltc.org.